Good morning everyone. Myself Sonali Nirankari from the Pharmaceutical Chemistry Department of D.Y. Patil College of Pharmacy. Today we are going to look after the topic drugs acting on the central nervous system. Here are the contents which we will be looking for the today's lecture. First is anesthetics, second is sedatives and hypnotics, and third is the antipsychotics. The main objectives of this lecture is, once we complete this topic, the students or the participants should be able to classify the drugs according to the action of the drugs on the CNS and explain the uses of the drugs depending upon the CNS disorders. Now we will be commencing with the first topic, that is anesthetics. Now in this anesthetics, you can see that these anesthetics are the agents which are going to depress the CNS, and when they are depressing the CNS, they will be including the two subpoints, that is they will be creating the non-awareness for all the sensations, and next is they will be losing the pain which will be not felt by the body. So the main two motives of these anesthetics are non-awareness of all the sensations and loss of pain. Next is the term anesthetic is These anesthetics are derived from the term Greek origin, which means without precipitation or insensibility. They cause the non-selective and the reversible CNS depression. Now here the most important term is the reversible depression. That is, the action will be shown for the particular period of time, and after that particular period of time the reverse will be there. That is, once the depression of the CNS is being done, it will be there for some time, depending upon which drug we are using. Some drugs will be acting for the short term, some drugs will be acting for the long term. So depending upon which procedure we are going to follow and the surgery time, then we can select which drugs we have to give, whether we have to give the drugs or the anesthetics for the shorter duration or for the longer duration. Next is classification of these anesthetics. Now here you can see the broad classification of these anesthetics is: first, inhalation anesthetics, which is including the examples enflurane, which is in the liquid form. Next is desflurane. Third, haloethane, and next is the ether. These are the examples of the inhalation anesthetic. Inhalation, from the term we can understand that taking in, inhaling. So these anesthetics are given by the inhalation. Next is the intravenous anesthetics. Now these intravenous anesthetics, again from the term we can understand, these are given intravenously inside the veins, and the examples are including thiopentanone sodium, ethamoid ketamine, fentanyl, and the diazepam. These are the examples of the intravenous anesthetics. And third category is the gaseous anesthetics, which is including the example of the nitrous oxide. Now whatever the classification we have seen, it was based on the which route we are going to give, and now we are going to look after the drugs which are there coming under the anesthetics. First is the thiopental sodium. Now in this thiopental sodium is administered intravenously for inducing the general anesthesia. Now whenever we are talking about the anesthesia, the terms are two. One is the general anesthesia, another is the local anesthesia. General anesthesia, the drugs which are giving the anesthesia or showing the anesthetic action on the whole body, and local anesthetics are the agents which are showing the activity on the local part or only the part which is where the anesthesia is given. Now this thiopental sodium is the agent which is acting as a general anesthetic, that is, it will be acting on the complete body, you can say. And next is, it is a anesthetic which is going to act for the very short duration. So the procedures which will be requiring the shorter period, they will be, at that time this thiopental sodium will be the drug of choice. Next part is the chemical name and the structure. Here you can see the structure of the thiopental sodium. In this thiopental sodium, the chemical name is sodium 5-ethyl 5-pentyl 2-sulfanyl 1,3-diazine 4,6-dione. This is the chemical name for the thiopental sodium. Next is its uses. The uses of the thiopental sodium. It is used as a sole anesthetic for the short procedures of the 15 minutes. As we have seen in the previous slide that this thiopental sodium is the agent which is going to show the action for the shorter duration, and hence it is useful for the shorter procedures of about 15 minutes. Next part is stability and the storage. It should be stored at 22 degrees Celsius, and this thiopental sodium remains stable and sterile for about 6 days if it is kept at 22 degrees Celsius, and if we are keeping it beyond that, then if we are keeping beyond 7 days, then it should be maintained, or the temperature should be lower to the 3 degrees Celsius. So as to increase the shelf life, the temperature is reduced. Next is the types of formulations of the thiopental sodium. It is available in the injection form, powder form and solution form. The marketed preparations of the thiopental sodium are pentothal first, anesthal, thiazole, thiojex and pentone. These are the marketed preparations which are available in the market by these brand names. So this was about the first drug which we have seen under the category of the anesthetics. Now we are moving for the second drug. Second drug is ketamine hydrochloride. Now in this ketamine hydrochloride, here you can see this is the structure of the ketamine hydrochloride, where the chemical name of this ketamine hydrochloride is 2,2-chlorophenyl 2-methylamino cyclohexanone. The uses of this is it is used as an anesthetic agent in the various diagnostic and the surgical procedures. Now as we are studying this agent under the anesthetic, that is it is useful for giving the anesthesia in the surgical procedures. It is also combined with the muscle relaxants if we need the skeletal muscle relaxation activity. Next is it is also given with the combination of the visceral pain desensitizing agent, that is whenever a surgical procedure is involving the visceral pain, at that time if we have to combine this visceral pain desensitizing agent, then we can combine it with the ketamine. Next is stability and the storage. It should be kept in a tightly closed container in a dry and well ventilated place. That is, ventilation means there should be air continuously over there. Next is the types of the formulations. First is only one type of formulation is available, that is it is available only in the solution form. The marketed preparations are the Ketalar, Ankate, Ketamine and the Workate. These are the brand names by which this substance is available, this drug is available in the market. So this was about the second drug, ketamine. Third, we are moving towards the propofol. Now this propofol is a class of the hypnotic which is belonging to the alkyl phenol derivatives. It is formulated for the intravenous introduction of the sedation and the hypnosis during the anesthesia. That is, along with the anesthesia, it is going to show the action of the sedation and the hypnosis. The chemical structure of this propofol is given over here. In this chemical structure, the chemical name is 2,6-dipropan-2-ylphenol. Here you can see this is the phenol structure, where at the second and the sixth position there is a presence of the propanol group. Next is the uses. Now in the uses, propofol slow down the activity of the brain and the nervous system, as the main role or main mechanism of action of the anesthetics is depressing the CNS first of all. So it is going to act on the CNS, it is going to act on the brain and the nervous system, and it is going to slow down the activity of both brain and the nervous system. It acts as a sedative and keeps asleep during the surgery or other medical procedures. That is, it is acting as a sedative, and whenever the medical procedures are going on, it keeps the patient asleep so that he or she does not feel any of the sensation. Most importantly, it is useful in the adults as well as in the children who are above the 2 months. It is also useful to sedate a patient who in case is of critical care and needs a mechanical ventilator. Next is stability and the storage. It should be stored between the temperature of 4 degrees Celsius to 22 degrees Celsius. Next part is the types of formulations. It is available in the emulsion form, suspension form and the injectable forms. The marketed preparations are the Diprivan and the Propovan. These are the two brand names by which propofol is available in the market. So this was about the first category that we have seen is the anesthetics. Now we are moving for the second category, that is the sedatives and the hypnotics. In this sedatives and hypnotics, the most important thing, we can differentiate them between sedatives and the hypnotics based upon their action and based upon their dose. Now here you can see these are the drugs which are reducing the tension and the anxiety. Along with that, most important thing is they induce the calmness, and when they are inducing the calmness, that effect, the calmness effect, is known as the sedative effect. Now this sedative effect, if more dose is given further, then it will be getting into the conversion of the sleep effect. So when the sleep effect is shown, that is coming under the hypnotic effect. Now in this point you can see the lower doses of these drugs exert the calming effect. When the lower doses are given, they exert the calm effect. So they are coming under the sedative effect. And if the doses are given at the higher range, then these are inducing the sleep effect. So when they are inducing the sleep effect, that are coming under the hypnotic effect. So the major difference between them, sedative and the hypnotic, is the calmness effect and the sleep effect, and the low dose and the higher dose. Calmness and the low dose is coming under the sedatives. Higher dose and the hypnotic effect is coming under the hypnotics. Next is sedative and hypnotics drugs depress the CNS. As we have seen in the first category also, the anesthetics, they are depressing the CNS. From the topic only we can understand the action on the drugs acting on the central nervous system. So whenever they are acting on the central nervous system, they have to make them calm, they have to reduce the activity of the CNS so as to reduce the pain or the sensation of the body. Next is drug like opiates can produce these actions. The most distinctive feature of this sedative and hypnotics is they are producing these effects without altering the mood or reducing the sensitivity to the body. Next is classification. Now in this classification, you can see here the first class is urea derivatives. Now in these urea derivatives, we are going to look after the further sub two types. First is diurites and next is related urites. Now in this diurites, the barbiturates are there. So these barbiturates are classified further as in long-acting barbiturates, short-acting barbiturates and ultra-short-acting barbiturates. Now in this long-acting, the examples are phenobarbital and meflobarbital. Next is short-acting barbiturates, butobarbital, secobarbital and phenobarbital. These are the examples of short-acting, and ultra-short-acting are thiopental and the hexobarbital. Now this was about the first category under the urea derivatives. Second category under the urea derivatives is the related urides, which is including only one example, that is glutamide. Now, as we have seen this first category urea derivatives, we are going to look after the second category, that is benzodiazepines. Now, as the term is benzodiazepines, we can split it. Benzo means including the benzyl group, di means two, and aze group, aza is the nitrogen. So these are the structures. Benzodiazepines are the structures or the category of the drugs which are including the two aza groups or the two nitrogen groups in their structure. Now here you can see they are sub-classified into hypnotics, anti-anxiety and anti-convulsants in this benzodiazepines. So we will be focusing only on the hypnotics as we are looking after the sedatives and the hypnotics, but benzodiazepines, these are the category of the drugs which are coming under the anti-anxiety and the anti-convulsant also. Even these anti-anxiety and the anti-convulsant, these are the drugs which are acting on the central nervous system. Next is miscellaneous drug. Now in this miscellaneous drug, the drugs which are not coming under either of the category, that is urea derivatives and the benzodiazepines, they are classified into the miscellaneous. The examples are chloral hydrate, traclopers and the paraldehyde. So this was about the sedatives and hypnotics. Now we will be looking after the drugs which are coming under this sedatives and the hypnotics category. In that, first drug is diazepam. Diazepam is a benzodiazepine. Again, you can see it is belonging to the category of the benzodiazepine. As I told you, benzodiazepine are the drugs which are having the benzo group along with the two nitrogen groups, which is having anticonvulsant, anxiolytic, muscle relaxant, amnestic and sedative properties. It has a long duration of action. So the procedures which are going to have a longer action or needing the longer duration of action, at that time we can give the diazepam for their sedative and the hypnotic activity. Here you can see this is the structure of the diazepam. Now in this, the chemical name is 7-chloro-1,3-dihydro 1-methyl-5-phenyl 2H1,4-benzodiazepine 2-ol. So here you can see this is the structure of the benzodiazepine, where the numbering is starting from here 1, 2, 3, 4, 5, 6, 7, 8 and 9. So here you can see, on the first position the 1-methyl group is there. Here you can see 7-chloro group is there. This is how the chemical structure names are given. The uses of this diazepam is, it is used for treating the severe anxiety disorder. The patients who are suffering from the severe anxiety disorders, at that time we can use the diazepam. Next is alcohol withdrawal syndrome. Next is managing the insomnia for the short term, the people who are suffering from the insomnia, and it is also useful for the pre-medicant, anticonvulsant and the sedative effect. The stability and the storage of this diazepam injection is chemically stable as 5 mg doses in disposable glass syringe for about 90 days when stored at 4 to 30 degrees Celsius. It should be stored in the refrigerator. Next is the types of the formulations of the diazepam. They are available in the tablet form, oral solutions, elixirs, injectable solutions. The marketed preparations, that is the brand names by which they are available in the market, are Campos and Sidenite. So this was about the first drug. Second drug is alprazolam. Now this alprazolam is a triazolobenzodiazepine compound having the anti-anxiety and sedative hypnotic properties. It is used effectively for treating the panic disorders and generalized anxiety disorders. The chemical name, here we can see the structure of this alprazolam. Now in this alprazolam also you can see the numbering is given over here, where we can see at the 8th position the chloro group is present, and the chemical name for this alprazolam is 8-chloro-1-methyl-6-phenyl-4H triazolo 4,3-A 1,4-benzodiazepine. Next is uses. It is used for managing the anxiety disorder. So the patient suffering from the anxiety can be treated with the help of this. Next is short-term treatment of the anxiety symptoms or for the treating of the panic disorders. Next is stability and the storage conditions. It should be stored in a dry place at a room temperature. Also, the bottle should be kept out of the sunlight reach, direct sunlight, or out of the reach, or most importantly out of the reach of the children and the pets. Next is types of formulations. It is available in the tablet and the extended release form. The marketed preparations are the Alzolam, Alzopax, Zonil and Exnil. Next is nitrazepam. Now, as per the syllabus, we don't have the chemical name and the structure for the nitrazepam, and hence we are directly shifting for the uses. The uses of this nitrazepam are: it is useful for the treatment of the panic disorders. Next is it is useful for the patients who are suffering from the insomnia, also for the patients who are suffering from the severe anxiety and the seizures. The stability and the storage condition for the nitrazepam is it should be stored at the room temperature and away from the heat and light. The types of the formulations of this nitrazepam are: it is available in the tablet and the capsules form, and the marketed preparations names are Somnite Sedamol, Hypnodex and the Nitravate. Next drug is phenobarbital. Again, we don't have the structure and chemical name. We are directly moving for the uses. It is used as an hypnotic, sedative and the anti-epileptic drug. It is used in the symptomatic treatment of symptomatic therapy of the epilepsy and in the nervous and the tension related state. The stability and the storage conditions for this phenobarbital is, as per the United States Pharmacopoeia, it should be dispensed in a well-closed container at controlled room temperature. Next is types of formulations which are available. That is oral elixir and oral tablet. And after that is a marketed preparation. The marketed preparations are Gardnerol, Garoin, Phenytal and Luminal. So now this was about the second category of the drugs acting on the CNS, that was about the sedatives and the hypnotics. Now we are moving towards the third category, that is antipsychotics. In this antipsychotics, these are the drugs which are mainly used for treating the schizophrenia. However, they can also be used in the mania, which means the agitation. Antipsychotic agents are also called as mood altering agents. Now here we can see the classification of these antipsychotic drugs. First is phenothiazines, phenothiazine derivatives. The examples include chlorpromazine and trifluoroperazine. Butyrophenones, which is including the examples of the haloperidol and the trifluoroperidol. Third is Rauwolfia alkaloids, that is example is Risperidone. Fourth category is the diphenyl piperidines, which is including the example of the pimozide and the penfluridol. Next is atypical neuroleptics, which is including the example of the clozapine, olanzapine and the risperidone. Next is indole derivatives, which is including the example of the malingol. Next category is the thioxanthin derivatives, which is including the examples of the chlorprothiazine and the hupothiazole. And next is the substituted benzamides, which is including the example of the sulpirides. Now this was about the classification. Now we will be moving towards the drugs of these antipsychotics. Here is the first drug of this category, that is chlorpromazine hydrochloride. This chlorpromazine hydrochloride is an psychotropic agent prescribed for treating the schizophrenia. It also consists of the sedative and the antiemetic activity. Here is the structure of this chlorpromazine hydrochloride, where the chemical name is 3,2-chloro-10H-phenothiazine 10-ill-NN-dimethyl-propan-1-amine. Here are the uses. The uses include: it is useful for treating the schizophrenia most importantly. Next is it controls the nausea and the vomiting also. It is useful for relieving the pre-operative restlessness, as an adjunct for the treating the tetanus, and it reduces the salivary and the gastric secretions. This chlorpromazine hydrochloride is also stability and storage for this chlorpromazine hydrochloride like oral solutions, tablets and injections should be stored at the temperature less than 40 degrees Celsius. Next is types of formulations. This chlorpromazine is available in the tablet form, oral solution form, elixir form, injectable solution form. These are the types of formulations. Further are the marketed preparations. Marketed preparations are largacetyl, chlorozine and copamide. Next drug is haloperidol. Now haloperidol is a phenyl piperidonyl butyrophenol and a traditional antipsychotic drug used for treating the schizophrenia and other psychosis. The chemical structure of this haloperidol is given over here. The structure name is 4,4,4-chlorophenyl 4-hydroxyl piperidine 4-fluorobutyrophenol. Haloperidol is used in the treatment of the acute psychosis, in the treatment of the schizophrenia, if the patient is suffering from the behavioral disturbances or the patient is suffering from the severe anxiety, and it is also having the antiemetic action. The stability and the storage of this haloperidol is, the haloperidol injections should be stored at the temperature between 20 to 25 degrees Celsius and they should be protected from the sunlight, but they should not be refrigerated. They are available in the formation of the tablet and the injections. The marketed preparations are Halidol, Trancodol, Cinerom and Halopidol. Next is the drug of the risperidone. Risperidone is a second generation atypical antipsychotic drug. The structure of this risperidone is given over here, which is having a chemical name 3,2,4,6-fluoro-1,2-benz isooxazole 3L 1-piperidonyl ethyl 6,7,8,9 tetrahydro 2-methyl 4H pyrido 1,2-A pyrimid 4-ol. The uses of the risperidone is, it is useful in the treatment of the mental disorders, useful for the treatment of the mood disorders and treatment of the bipolar disorders. Next is stability and the storage condition. It should be stored at the room temperature, away from the light and moisture. The liquid form of this medicine should not be stored at the should not be refrigerated and should be kept away from the children. The types of formulations are tablet and the injection form. The marketed preparations names are Risperidone, Sizodone and the Risperdal. The next drug from this antipsychotic category is sulpiride. Now this sulpiride, the chemical name is N1-ethylpyrrolidine 2-L-methyl 2-methoxy-5-sulfoyl benzamide. Here is the structure of this sulpiride. It is used in the treatment of the schizophrenia. It is used in the treatment of the constipation. Constipation is the condition where the complete waste material from the body is not removed from by the body of that patient. And next is to treat the dyspepsia. Again, it is the discomfort of the stomach or the digestion process. Next is to prevent the nausea and the vomiting. Next is stability and the storage conditions. It should be stored at the room temperature, away from the light and the moisture. The liquid form of this medication, again, it should not be refrigerated and it should be kept away from the children. This is available in the three types of the formulations. First is tablet, second is capsules, third is solutions. The marketed preparations are Salpitac, Amiprid and the Zonaprid. The next category of this drug is the olnazepine. Now in the olnazepine, here is the structure given over here, which is having the chemical name 2-methyl-4,4-methyl-1 piperazonyl 10H thieno 2,3-B 1,5-benzodiazepine. It is useful in the treatment of the schizophrenia. Next, it is useful in the treatment of the acute manic, useful for the patients who are suffering from the bipolar disorders. It is given in the adults, and to treat the depression. The stability and the storage is, it should be kept at the room temperature away from the light and moisture. Again, it should not be refrigerated, and it should be kept away from the children and the pets. The available formulations are tablet. The marketed preparation is Olazex, Simbax, Xylasta and Zyprexa. Next drug is the quetiapine. Now this quetiapine, we do not have the chemical structure and the chemical name as per the syllabus. Uses of this quetiapine is, it is useful for the treatment of the schizophrenia. Next is, it is useful for the treatment of the bipolar disorder. It is useful for the treatment of the it is used along with the antidepressant medication. Excuse me. Next is, it is useful, its storage and the stability. It should be dispensed in a well closed container at the controlled room temperature. The types of the formulations include the tablets and the capsules. Marketed preparations: Coel, Socalam, Securin and the Sequel. So this was about the drugs which are acting on the central nervous system. Thank you.